Hi, my name is Don. I'm a respiratory care student at Malcolm X College here in Chicago, Illinois. Today, I'm going to be talking about full ventilatory support. Full ventilatory support provides all the work of breathing for a patient on a ventilator, and it also helps to maintain effective alveolar ventilation. This means that the patient doesn't have to do any work of breathing. It also helps to normalize the patient's ABG. But before we put the patient on the ventilator, we have to put in certain parameters into the settings. So to figure out what these parameters are, you have to do some math. So I actually came up with an example here. So I picked a female 5'8". The mode would either be assist control or SIMV. So to find out the patient's ideal body weight, you would do 105, use 105 for a female. We have 8 extra inches, so you do 5 times 8, which is 40, plus 105 gives you 145 pounds. You would take 145 pounds, and you would divide that by 2.2 to get the patient's kilogram, weight in kilograms. So you would plug that into the settings. Your sensitivity, normal sensitivity on the ventilator is 2. To get the patient's predicted tidal volume, you would take their weight in kilograms and you would times it by 6, 7, or 8 to get a range of their tidal volume, what the patient's tidal volume can be. Usually I stick with 7, so I'm going to stick with 460 mLs for the patient's tidal volume. To find out your inspiratory and expiratory IE ratio, you're going to do 60 seconds divided by 14 breaths equals your total cycle time. So you would take your total cycle time, minus it by your inspiratory time to get your expiratory time. FiO2 should always be less than 60% if possible. Your respiratory rate, you can choose anywhere between 12 to 16 breaths per minute. And the flow that you will be giving the patient. So you would take 0.46, because our tidal volume was 460, so I took 0.46. I divided it by our I time, which was 1. Times that by 60 gives you your liters per minute for flow. And then you would also set a PEEP pressure. PEEP pressures normally are between 5 and 8 centimeters of water pressure. So that is full ventilatory support.